Hi, I'm Dr. Nisha Jhalani. I'm a cardiologist at Columbia University Medical Center, and I am the director of the Women's Heart Health Initiative here at CRF. I'm here with Dr. Cheryl Pegus, who is the chair of the Association of Black Cardiologists, and she and I together have co-founded A New Beat. We held our inaugural program on May 30th called A New Beat, Improving Cardiovascular Outcomes in Women and Underserved Populations. We were thrilled to have such a great attendance and so many faculty members and so many attendees be such an active part of that program. And Dr. Pegus, why do you think that people at home should be logging into anewbeat.org, and why was this message so important to share?
I think there's a lot of information that even those of us in the room, and frankly those of us who've devoted our careers to improving health disparities, improving care for women, and making sure that we support women in furthering their careers, we all learned something yesterday. So some of my takeaways in particular were the impact of teams. Today, care requires teams. It requires physicians, nurses, pharmacists, maybe even social workers, and we need to understand what's going on in someone's home, the social determinants of their health. And we're already beginning to do this. And frankly, hearing the women yesterday talk about, no, I've done this almost my entire career. Now we talk about it as a team-based approach, but I've always known that this was important. So I think that was a really important message. I think we also really looked at all of these issues, right? So reason health disparities exist is not because your physician may not understand guidelines. It may be because in your community you can't access a physician, you may not be able to afford your medicines, or there may not be a facility in your community that you live in that provides a service like TAVR. And the big takeaway yesterday, I think, for all of us was, now that we know all of that, what are we all going to do? This isn't a pass the buck to somebody else to solve the problems. Physicians are leaders. We care for a great deal of these patients. We as women care for each other. How do we work together to do that? So I thought those were two really great takeaways. My third takeaway from this was that as new treatments are developed, and as we look at treatments for VTE, there were many in the room who were hearing about new treatments for the first time. And so the continued education, particularly for underserved groups, is a real necessity. And I think for A New Beat, how we continue to provide CME programs, online events, Facebook events, and then translate that for a common person, a consumer in the street, is just as important. And so I'm really looking forward to working with you and working with the wonderful faculty, attendees, nurses, administrators who want to be a part of this journey with us.
Absolutely. I think one of the best things that came away from the program was that there were so many different team members in the room. It wasn't just a conference that was focused on physician education. It was really education of the entire healthcare system. And we had somebody from every level in the healthcare team and healthcare system in that room yesterday. And I think that that was such a great takeaway, because it really does. People have been working in teams forever, but we need to make sure that we're reaching, the message needs to get to everyone. So that was such a great takeaway. I think it also, the point that you made about access being not only due to socioeconomic status, but also due to your location, due to not knowing a lot of what, even physicians not knowing a lot of what the most recent innovations and therapies are for certain conditions. And I think that there's a inertia that happens in medicine, and unless we challenge ourselves to be on top of things and to know the latest treatments, it's very easy to fall behind. I think that there's so much to be said about patient education and getting the message out to the consumer, to the patient, and making sure that they know what's best for their own health care. And that's a lot of, I think, the missing piece of this is making sure that people know what to ask for when they go to the doctor, so that they're empowering themselves and furthering their own care.
I also think that another big takeaway is that this is a partnership between the Cardiovascular Research Foundation and the Association of Black Cardiologists.
Absolutely, it's a great one.
It really says that organizations, not just those who are devoted to working on improving health equity, recognize the need, see it as a great priority,
Right.
and are working together for that. And so I think for us, we have to remember in a new beat, everyone who wants to partner, we need you as a partner.
Absolutely.
This is as many people as we can get to do this, because there are other organizations who
Right.
focus on heart disease, who focus on education. We still have all of these gaps, which means we have all of these needs, and everyone can play a role. I think I really want people to not feel, oh, this is covered.
Right.
It's not covered. We're sitting here talking about the fact that we still, I know for myself, I mentor lots of people of, how do you set yourself up when you go in for the new interview for the job? An opportunity has presented itself. How do you make sure that you feel confident that you're the right person for that role? How do we make sure that when we're providing education to different groups, I find that if someone's educating on VTE, if you're educating African Americans and all of the imagery and booklets that you have no African Americans in it, that's a miss. If you haven't looked for, be it anyone in America, if you look at the IOM report and says that there is significant health literacy, whether you're a college graduate or not, and your materials should be written at a 5th and 6th grade level,
Right.
if you don't know that, then you may be feeling that you're doing great education and you're missing almost all Americans. You're particularly missing underserved communities. And if you're not providing it in languages that reach communities, then you again have missed an opportunity. So I think in a new beat, these are things that come naturally to us.
Right.
And if we continue to represent that, and frankly, everyone who joins with us represent that at every meeting, we will see differences. It does not require someone being a member of ABC
Right.
or signing on to a new beat just to find out, hey, that's great information. It's how do you take it and make it actionable? And that's the real goal of a new beat. Administrators, nurses, pharmacists, everyone, you can make this actionable just by bringing it up.
Yeah, and there's so much work to be done, and it can't be done by physicians alone. And
Right.
so that's what makes it so important to make this an all-inclusive effort. I think we need to work with, organizations need to work with each other more readily and like we've done, and hopefully this sets an example. But for organizations to have crosstalk and to be at the highest levels and make this kind of initiative a priority, and spread the word throughout the healthcare system and to the patients. I think I can't thank you enough for your leadership in ABC, but also for your mentoring and guidance throughout the process of creating this program. It's been so vital, and I think that we all women cardiologists have so much to learn from one another, and I definitely felt that in the process of making this program come to life.
Thank you very much. And you heard me say this yesterday. There were women in that room, Stacy Rosen, who did that for me. So I think for us, we have to remember the networking that occurs, when a group of guys go to get a beer after work, or they get together for a sporting event. They're supporting each other as well. And though we tend to think, gosh, we've got so much to do, that ability to meet with each other, communicate with each other, that frankly technology now enables, really allows us to see a broader view than what we may do on a daily basis. I think the other thing that I felt yesterday with this event, and as we talk about a new beat, I really felt that people were, what's next?
Yeah.
We'd like more. What's the schedule? And so from our website and the information that we'll be providing on a regular basis, to doing events where we again do CME events, but sometimes not a CME event, a Facebook Live event where we're taking questions, where we're partnering with other organizations when they have live events and hosting a seminar. I think our goal is to make sure that we're using all mediums to be able to spread the message, and all partners. And really, this isn't a pride of ownership. It's more, here's the work that needs to get done.
Absolutely.
You'd like to help? We'd love your help. My only last takeaway that I had from the event, our first inaugural event, is that healthcare is very personalized. And that when we see an individual patient come in, if we just look at the clinical condition or look at their race, we miss so much. Keith Ferdinand made the point that for the patient who in your room may not seem to understand what's going on, if you'd spoken to their family member in the waiting room, you would have found out that their son was a lawyer. And until you have that person engaged in the care as well, you may not get the best treatment, understanding, or ability to help your patient. And so I think we have to recognize that as physicians, even when we're doing the one-to-one relationship, we think of our team care, families have a team. And I think that really came through yesterday as well.
Absolutely. I think that was such a great point that was made by Dr. Ferdinand. The best clinicians that I see in the hospital and in clinical practice are the ones that start by telling you about a person's social situation, right? This is a 80-year-old retired general from the Army.
That's right.
This is it's a really sad story. Their sister has breast cancer and they just found out last week. But the people who start with the family one-liner are the ones who know their patients the best, and the patients who trust their physician the
That's
most. And that's something that a lot of the physicians where I work at Columbia have taught me, because it's amazing to see the loyalty and the trust that people feel in their clinician when they have that relationship.
Thank you very much.
Thank you.